Sagittal section of female pelvis. Female urethra 4 cm. Stratified squamous epithelium. Urethra and vagina passes deep perineal pouch and superficial perineal pouch to open in vestibule. Posterior colpotomy. Puncture posterior fornix of vagina to collect pus from retrouterine pouch of Douglas. Deep perineal pouch has external urethral sphincter to hold urine at our own will is controlled by pudendal nerve, which sends fibers around vagina. Works like ureterovaginal sphincter to hold vaginal content. Greater vestibular gland of Bartholin duct opens in superficial perineal pouch. Duct is lined by stratified cuboidal epithelium, but its opening part is lined by stratified squamous epithelium. Parietal peritoneum continues as visceral peritoneum, covers the fundus of urinary bladder, upper part of rectum, and goes to posterior abdominal wall as parietal peritoneum. Then rectovesical pouch, most dependent portion of male in erect posture. Pus collected here can be drained per rectum by puncturing the pouch. Denon-Willer's fascia, rectum posterior, prostate anterior. Waldeyer's fascia in front of sacrum, behind rectum. Denon-Willer's fascia, rectum posterior, prostate anterior. Waldeyer's fascia in front of sacrum, behind rectum. Prostate urethra, then membranous urethra, then spongy urethra. Spongy urethra has two parts: short bulbous spongy urethra, long penile spongy urethra. Superficial perineal pouch has bulb or root of penis covered by bulbospongiosus muscle. Cowpers are bulbourethral gland, present in deep perineal pouch. Duct punctures perineal membrane and enters superficial perineal pouch and opens into bulbous spongy urethra. Fascia layers in male. In anterior abdominal wall, two fascia: superficial Camper's fascia, fatty liver, deep scarpa fascia, membranous layer. Scarpa fascia becomes continuous with penile fascia, scrotal fascia, collis fascia, reaching perineal body, attaching to perineal membrane posteriorly at floor of deep perineal pouch. In case of straddle injury, ruptured bulbous urethra, urine is extravasated into superficial perineal pouch, scrotum, penile shaft, anterior abdominal wall in front of pubis bone, deep to scarpa fascia, anterior to external oblique muscle. Urine cannot reach deep perineal pouch, which is prevented by perineal membrane. Urine cannot enter ischiorectal fossa, prevented by collis fascia. Urine cannot enter thigh layers, prevented by deep fascia lata of thigh. Pelvic fractures may result in pulling of puboprostatic ligaments and rupture of membranous part of urethra. Urine will be in perivesical space around urinary bladder. Rectopubic space of ridges extending into anterior abdominal wall deep to external oblique muscle attaching to pubis bone. Urine is in extraperitoneal space, not going into intraperitoneal space because peritoneum is intact. Transverse section of penis. Corpus cavernosum containing artery, corpus spongiosum containing urethra. Deep buccal fascia covers corpus cavernosum and corpus spongiosum. Supports of uterus: muscular, dynamic support, provide excellent support. They are pelvic diaphragm, urogenital diaphragm, then perineal body. Pelvic fascia condensation, they give passive support, provide good support. Lateral cervical ligaments of Meckenrod, pubocervical ligament, uterosacral ligament. Angulation of uterus, provide poor support. Round ligament of uterus, sacrouterine ligament. Uterine position and axis. Between long axis of vagina and cervix 90 degrees angulation known as angle of anteversion. Body of uterus is folded on cervix of uterus 125 to 770 degrees known as angle of anteflexion. Both angle of anteversion and angle of anteflexion helps to prevent the uterus from prolapsing through vagina outside. Anorectal ring, angle between rectum and anal canal 90 degrees to 120 degrees. If it's 120 degrees, tendency of fecal matter to enter anal canal, defecation begins. Anal canal, ecto-endo junction, pectinate or dentate line, white line of Hilton, divides outer part of anal canal. Arterial supply of pelvic region, superior, middle and inferior rectal artery, also known as hemorrhoidal artery. Then venous drainage, dentate line, portal systemic anastomosis area. In case of portal systemic hypertension, reversal of blood into superior rectal vein and inferior rectal vein leads to rectal varices. Internal hemorrhoids above dentate line, painless bleed ANS, superior rectal artery and vein. External hemorrhoids below dentate line, inferior rectal artery and vein. Pelvic nerve supply, pudendal nerve. contraction of external sphincter to hold urine.